bunch of you received an email from the Social Security Administration talking about taxes, and that's a pretty scandalous email, if you ask me. There's all kinds of different limitations on what federal employees, federal organizations, federal agencies can say, and that is definitely not in the wheelhouse, that email that went out. So that is all kinds of different Hatch Act violations. I worked for the Social Security Administration for a few decades, and I can tell you right now, if I had sent that out, yeah, I wouldn't have worked for the Social Security Administration for a few decades. As soon as I had sent something out like that, I would have got, as we used to call in the Marine Corps, a BCD, a bad conduct discharge, or as we used to say it, a big chicken dinner. So yeah, they would have definitely drummed you out. But I guess it's a whole different world, and they have a email list that you said the Social Security Administration, when you sign up for My SSA, which everybody should sign up for, go into SSA.gov and set up a My Social Security account. That is definitely one thing you should definitely do to check your earnings record and all that kind of stuff. But when you go in there and do that, then what you do is you give the Social Security Administration permission to email you and text you and all that kind of good stuff, which is under normal circumstances a good thing. But yeah, you definitely didn't want political messages from the Social Security Administration, which is essentially what you got. Okay, that aside, let's talk about the actual email. And it talks about, I'm getting a lot of people contacting me and says, Ed, we don't have to pay taxes on Social Security more. See, a campaign promise that actually came to fruition. Well, sorry. You still have to pay your taxes on your Social Security benefits. If you ever did. About half of the people out there don't even pay taxes on their Social Security benefits because they're at a lower threshold. So about 50%, lower 50%. If all you're receiving is Social Security benefits and working a little bit, then you're not paying taxes. You didn't pay taxes on your Social Security benefits last year or the year before or the year before, the year before, and you're not going to pay them on this year. So it doesn't really help you all out. It looks as though, because you just don't know that, oh, wait a second, I don't pay taxes. But it definitely helps the people that are making more money. They get a tax break. And then, to be fair, after about 75,000, 175,000, after that, it starts to basically dwindle. It's basically a deduction, a $6,000 deduction if you file individual, and a $12,000 deduction if you file as a family. So you still, if you have to pay taxes, you still have to pay taxes, but you'll get a deduction, and then a $6,000 deduction. So if you made $100,000, then how a deduction work? IRS thinks you just made $94,000, so they deduct $6,000. So there's a lot of people emailing me as well and coming into the live Q&A, which I'm about to start the live Q&A. This is going to be a short topic today. So a live Q&A is going to start soon. So got a lot of people asking, when are we going to get that $6,000? Is this a stimulus check? No, it's not a stimulus check. It's not that so-called Doge dividend that everybody's been talking about. That there is no stimulus check. So social media people out there talking about leading people on with a stimulus check, please stop it. Because what happens is that it ruins it for everybody else. Every time social media people used to talk about a stimulus check, that Social Security is giving out a stimulus check, what happens is everybody calls the Social Security Administration, or they go down to the local Social Security office and says, hey, where's my check? And this happened more often than I would like to admit. That ruined that particular day. So all those people coming into the office to get Social Security cards, to file for survivor benefits, disability benefits, retirement benefits, whatever the case may be, they had to wait 10 times longer, which is even worse now, because we had to sit there and says, yeah, how can I help you today? Oh, I'm looking for that check. No, there is no stimulus check. I'm sorry, that's social media BS. No. And then the next person would come up, where's my check? No. So we'd spend all our day answering the phone and saying there is no check. So social media people out there, you're doing a disservice by leading people on about that whole server, stop it. Just stop it. So long story short, just stop it. And just a while ago, we got another email from the Social Security Administration talking about the key milestones in customer service transformation. And one of the things they said, completing over 3.1 million payments to all those who are entitled on the Social Security Fairness Act, 5 months ahead of schedule. Well, no, when the Social Security Fairness Act passed, you can go back to my previous videos that I did. I said it should take about 3 or 4 months because most of these are auto. It is just unwepping the PIA, so it's a technical thing. So it should have taken this long. It shouldn't 4 months early. No, there's not 4. There are people out there that are missing those benefits that are eligible and entitled to those benefits, but they just don't know about it. Yeah, I think those. So they're estimated about 95% of those are done. I think there's still about 5 or 6 or 7% out there that unfortunately people are going to miss. And I've done several videos on that to try to get people out there to go get those benefits. And invariably people say, "You're lying, Ed. You're talking about those stimulus checks." And no, it's not a stimulus check. It's actually the Social Security Fairness Act. And only 3% of the working population gets it. You had to be a state, local, city, or federal employee. You had to work for the government and a government entity that did not pay into Social Security. So it's not fake, those particular ones. It's fake for the other 97%, which I think is a scandal. But anyway, I lost that battle. And they're also talking about phone service, and congratulations, phone service has improved. They are going with this AI thing. And I think how they improve the phone service with AI is you call and you have to speak to this stupid computer and they don't know what you're talking about and you just hang up. And so you don't have to talk to anybody. You're not routed through to an actual human being. So that improves the phone service metrics. So yeah, the email that went out today is, yeah, much ado about nothing, as our good friend Shakespeare would say. All right, so I've rambled on enough. Let's get into some actual questions. And I've got a whole bunch of video questions as well that people sent me questions on my website and want to know specific things. So that is awesome that people are doing these videos now. So let's get into some actual questions. Let me pull up the questions here. And if you're just here for the topic of the day, then have a great day. But if you want to stick around for the next 50 minutes and listen to me answer questions, then stick around. Ed, I sent you an email that states in 2026, Medicare will start to require prior authorizations on traditional Medicare in 6 states. It starts with a pilot on some items, then they will expand it. Okay, yeah, okay, but I saw the require. I'm going to do a video on this. I've got Ari from Chapter. He's our super Medicare guy, Medicare plans. These are the prior authorization. As soon as you say prior authorization, that means Medicare Advantage plans. So he's our guy on that. I'm going to have him come hopefully this week or so and talk about those. But for the most part, it is a pledge by most of the Medicare Advantage companies out there that they're going to do the right thing, which they should have always been doing. But anyway, yeah, but they're doing a little pilot thing where they're going to make things, which is always good. I mean, that's the problem with Medicare Advantage plans is one is those networks, the diminishing networks. You can't go to this doctor. You can't go to that doctor. You can only go to this other doctor that you really don't like. And it's way, way over town. So it's those networks. That's why I always recommend Medicare supplement plans, the Plan N or the Plan G, once you get original Medicare. But this is a step in the right direction. This is a policy that they passed out about the last year or so. They've been working on for a long time. This is not new information. But yeah, it's good. It is good. Yeah, that they're continuing on with it is a beautiful thing. Yeah, if they get rid of the prior authorizations, it will definitely help out a lot of people. Whether that is true or not, the channel is dedicated to all things Social Security, Medicare, etc. This is not a political channel. We are not a partisan channel. We are political in the sense of politics is about resources. And we are one-trick ponies here. All of our resources, Social Security resources we think should stay for Social Security. So yes, we are kind of political in the sense of we want to support Social Security and make sure it's here for the future. And the great thing about this channel, even though it's, it's not partisan, Republican, Democrat, we don't care. If you support Social Security and Medicare and, some of us Medicaid, then we don't care what hat you wear. We got your back. We like you in that particular instance, right? And the great thing about it is the polling proves it. 90% of Democrats, 86% of Republicans, 88% of independents says despite claims of deep polarization, there's a significant bipartisan agreement that Social Security must remain a priority in the U.S. So yes, 100%. That's our political thing, is to keep Social Security around for us and our kids and all the rest of it. So we all have political views and differences. I think we should all try to be respectful and let others express their opinions, but do not troll. Yes, please, please, please. Yes. All right, Karen, my question. My 17-year-old grandson is disabled and has been on SSDI for years. When he turns 18, will his checks continue as an adult, and will I remain his representative payee? Okay, yes, you will remain his representative payee. That's not an issue. So the grandson was receiving child benefits, CDB, child disability benefits. And then when he turns 18, they'll just have to switch it over to regular disability benefits. So if the parent is receiving benefits, if one of the parents is receiving retirement or disability benefits, or one of the parents has passed away and they're, we're insured, then the child can get what's called DAC benefits, disabled adult child benefits. So he has to file as an adult. So you have to contact Social Security about, few months before he turns 18, contact Social Security and say, hey, by the way, his grandson is still disabled. Parent is receiving benefits or deceased or whatever the case may be, and they will do the application. And it's a different type of process to determine eligibility for an adult versus a child. That's why you have to go through the whole rigmarole one more time. And in terms of, you mentioned grandson, grandchildren cannot get benefits off of the grandparents' record unless you've adopted that grandchild or the parents are deceased or disabled or disabled. So if the parents are both deceased or disabled, or deceased and disabled, one can't be both, but anyway, you know what I mean. Then a child can get benefits off of the parent's record. And for more details on that, you can go on to my website and through the, the family benefits there. And it talks about, I think I've got, where is it? We got so much information on my website nowadays. Child benefits. Yeah, child benefits. It should be on there. Yeah, there we go. Can my grandchild receive Social Security benefits based on my record? So it gives all that, equitably adopted, and what you have to prove and all the rest of it. So yes, grandchildren can get benefits on their grandparents' record, but it is under limited situations. So, can everyone please pray for my church mother? She's in the hospital and ICU in Savannah, Georgia. Yes, Joseph. Wow. Thank you for looking out. We are an awesome community like there, and I'm sure everybody is thinking about her. Rum Runner, stop paying taxes. Government employees just harm the public with the fraud funds. Pay public back. Okay, all righty. Is it better to start Social Security age 62 with so many possible changes possible? That's a decision you really have to make yourself. And on my website, I've got, on my website, it's all free resources. So you can go in there and look at it, mygovexpert.com. I've got free calculators on there. And then on the when to start, you go into retirement. You go into when to start, and I've got a little calculator there. When you start your benefits, it does a little calculator and does nice little graphs and stuff like that. You don't need to register and give me your email to access that. It's there. It's for you. It's for free. And then it has you a bunch of questions. So super long story short, nobody can tell you when you should start your benefits. It's completely 100% on your particular situation, whether you need the money, you're working, how's your health. And yes, unfortunately, the entire Social Security, kind of situation, the future, we're looking at about 2031 or 2032 that there's going to be cuts in Social Security because the trust fund is running out. So, and we've known about the inevitable collapse of the trust fund. Social Security will still be around. So Social Security, for those new people out there that are just new to my channel, Social Security will be around here for hundreds of years. Don't worry about that unless, we decide to give it over to Wall Street or something, or we decide to completely close it down. So if we keep it as it is, we don't give it to Wall Street or decide to, whatever, then Social Security will be here for hundreds of years. The problem is how much your check will be. So right now you're getting 100% what your calculation says. In about 2032 or so, you're probably going to get about 70%. Or 70, probably 76. So you're about 23%, 24% cut. So look at your check right now and say, okay, it's going to be reduced by about 20% in just a few years. Because Social Security, they pay most of the money that comes in on a daily basis comes in from people working and paying FICA tax. So that's going to cover, 70, 80% of your check. And that covers 90% of your check now. The other 10% or so right now comes out of the trust fund and that savings. And the trust fund is slowly being diminished. And one day it will be gone. Catherine, so reach out to your politicians and tell them to fix it. Yeah. My parents would have qualified for the benefits from the Social Security Fairness Act. Sadly, they passed away. Oh my gosh. Yeah. Lisa, I emailed Midas Touch and told them all about Dr. Ed. Okay, thank you. Yeah. Any exposure we can get out there is awesome. I think we're probably the fastest growing YouTube channel other than, someone blowing up stuff in their backyard. You can never compete against blowing stuff up. So I might have to, get some firecrackers or something, blow some stuff up, and then we'll hit 1 million. But yeah, for the boring topic that we are, yeah, I think we're doing really good, and that's because of y'all. Yeah, so many people out there. If Social Security picked up the phone and made the right decisions and actually helped you out, then yeah, I would lose all my followers. But until they start doing the right thing and the improved customer service, I'm going to be here to help y'all out. I haven't got the WEP money yet. I am tired of being on hold. I didn't have the money before, so if they miss me on, oh well, SSA is messed up. So yeah, so the WEP money, the windfall elimination. So if your benefit amount was WEP'd, the windfall elimination provision, if it was recalculated, you would say it was reduced. I'd argue with that. But if your benefit amount was less, because of the windfall elimination provision calculation, then yeah, they should have fixed that and they should have given it back to January 2024 based on the law that was written. If that didn't happen and it was supposed to, then yeah, then if you were WEP'd, that was a simple calculation. That's what I said back in January, February when this thing is. If your PIA is WEP'd, then it takes no time to fix that. So I'm thinking there's another issue there, that maybe your PIA wasn't WEP'd at all. But if it was, then it's time for you to reach out to your politician. Call your politician and say, hey, my benefit was supposed to be recalculated. It was supposed to be unwept, but it hasn't. What's going on? So you worked in a government entity that did not pay into Social Security. So Felicia, look at that. Joseph, I'm praying for your church mother. God is see, look at that. That's why we're at close to 600,000 subscribers, because we got 600,000 awesome people. And then we got one idiot that sits there every day and blabs on for an hour. So sorry about that. What are you going to do? I'm 82 and will make 32,000 after all the deductions, including the $6,000 bonus. Bonus deduction. Yeah. According to my tax man, I will save only $720 in taxes. So the 6K is a tax deduction, not a tax credit. That is correct. So yeah, people think they're going to, it's too many people think they're going to get a $6,000 check or a $12,000 check. Yeah. And that they're not going to pay. And this is also only temporary too. It's only for what, 2 or 3 years. The tax cuts for the rich, oh yeah, they they ain't temporary. Yeah, they go on forever. So if you got a $1 billion, you're gonna get more than $720. So this is where most of the money from Medicaid and all that's we have to give it up for a new yacht or yeah. If I sign up for a divorce SSA, then he passes away, can it change to survivor? We were married 21 years, divorced way more than 2 years. Yes. And it's called what's called an auto convert. So if you're on a person's record as a spouse and that person passes away, your current spouse or your divorced spouse, whatever the case may be, and that person passes away, then your benefits are automatically converted to surviving spouse benefits. There's an exception. If you're past your full retirement age, then it's automatically converted. Because the reason is if you are receiving spouse benefits and that person passes away at 64, you're going to be converted to surviving spouse benefits, but it just might be a reduced surviving spouse benefit. So Social Security is supposed to reach out to you and say, hey, do you want to go ahead and, and switch over to surviving spouse benefits, or do you just want to go ahead and stay on your own while your surviving spouse benefits increase until your full retirement age? So they're supposed to give you that option. But if you're past your full retirement age, it's automatically converted. So, Gypsy, I sent you a live video asking about my SSI and Medicaid. Yes, I've got well, speaking of that, I might as well, let's go ahead and grab a couple of these live videos right now.
So I reached my full retirement age, end of July. And my question is, if I started drawing Social Security, my wages are going to, for the year or for that prior time, are going to be past the 62,000. Does the 5180 monthly, how does that work? Is it the 62,000 or is it the monthly? And am I going to get penalized based on the monthly? Or if I made, say, 70,000 in the first 6 months, I would pay the penalty $1 for $3 on the 10,000 over, or do they base it on the 5130 or 5180? That's
okay. Good question. Complicated question. A lot of people miss this. Okay. So if you're filing for retirement benefits, spouse benefits, divorce spouse benefits, surviving spouse benefits, whatever the case may be, under your full retirement age, you're limited the amount of money you can make. Because Social Security, when they started in 1935, they said, hey, this is supposed to be a replacement for lost wages. So if you continue to work, you didn't lose your wages. But once you hit your full retirement age, like you, I don't think this is Gypsy. Gypsy, this is not you, is it? Okay. But if you're at your full retirement age, none of that matters. If you started your benefits at your full retirement age, you made $1 billion the month before you started your benefits, Social Security doesn't care. So that sounds like it's your particular situation. If not, if you start your benefits in let's say January, and you start in your full retirement age is July. So from January until June, that's what they look at. So it's $62,160. So 62,000. There's also a monthly thing. Like if you make over $62,160 in January, and then you stop working in February, then they look at the monthly earnings limit, which is the 5,000 or so starting February. So, but in your case, so yeah, if you made over $62,160, then they're going to hold back $1 for every $3 you go over, unless they can do the monthly earnings test. So if you start in, let's say you said in March, you made $100,000 in January, $100,000 in February, starting in March, you stay under the monthly, the different monthly, then you're good. So yeah, it's different. The year you turn your full retirement age, the calculations are different. It's not the $23,400. It's $62,160 only on those months before you hit your full retirement age. And then once you start your benefits at your full retirement age, you can go back to making $1 billion a month like you used to. So
Really, I really appreciate everything that you're doing online. It's tremendously helpful.
thank you.
So I'm on Medicare. My income is only 1,800 Social Security. So I have the MSP. I just want to know what's going to change this year, if anything. Everybody is saying nothing's going to change until after the midterms, but now I'm hearing otherwise. So just want to know what's going to change this year for Medicare.
Okay. All right. So a couple things. So the MSP, what she mentions is Medicare Savings Program. So if you're making 1,800 and you're receiving the Medicare Savings Program, you're in a pretty generous state. And in a lot of states, if you make over 1,500, you're not eligible for it. Basically, the Medicare Savings Program is you have Medicaid, so that your state gives you Medicaid, the higher levels of Medicaid. And one of the benefits of that is that they pay for your Part B premium, that $185. So that puts another $185 back into your pocket. So it's a beautiful thing. And that's the MSP, the Medicare Savings Program. And yeah, for a lot of people, that's gonna go away, unfortunately, because a lot of people are gonna lose their Medicaid, or they're gonna be downgraded from higher levels of Medicaid to lower levels, or medium or lower levels of Medicaid. And those don't have that paying the $185 Medicare Savings Program thing. So a lot of people, and the double whammy on that is, if you have the higher levels, you're also eligible for what's called a Medicare Advantage dual eligible plan. Those are the ones that have those extra grocery cards, the $100, $200 grocery cards, or whatever, depending on what's available in your area. So if you lose your higher levels of Medicaid, you also lose that Medicare Advantage dual eligible plan and that extra transportation and grocery cards and whatever else goodies they have on there. So not only do you lose your $185, you might lose that grocery card, and you have to pay extra for your, you go to the doctor, you go to the hospital, go your prescriptions, you have to, there's so many extra costs. And when is it going to happen? Technically, it's not supposed to happen. Yeah, they're not really pulling the plug until after midterms, politicians. But that's nationally. So what we already see happening is some states are considering, they're looking at their budgets, their state budget, and they say, hey, next year or so, or the year after, we're going to get, they're going to cut $1 trillion out of this whole thing. And you can't cut it, we see numbers thrown around all the time. $1 trillion is still a lot of money. So $1 trillion can't be cut out of a budget and it not hurt people that it wasn't supposed to hurt, the collateral damage, unfortunately. So in your particular state, in any particular state, they might say, yeah, this thing technically nationally is not going to start till next year or after the midterms, or whatever the case may be, but our state budget is hurting. So let's do this. Let's, instead of, giving it to people with $1,800, let's move it down. Says, okay, if you make over $1,700, then, then you can keep it, or $1,600. So they're going to lower it, make it more difficult. So if you're making $1,800, you might not qualify anymore. So the states can kind of play around with that. So I'm keeping an eye on that. And so what you should do now to help prevent that, rather than waiting for that ball to fall, is to reach out to your politicians, your state politicians, and say, hey, me and a lot of people are dependent on this Medicaid. We liked having health care. We like not having to, clog up the emergency rooms and stuff. So make sure that y'all don't do stupid stuff like this. And another thing that they do is there's this kind of, I call it bureaucratic disenrollment, where they put up so many hurdles. And that's what the federal government did in the big, beautiful bill. They put up a whole bunch of different hurdles to where, oh, okay, we're not technically cutting you off, but we're going to make it really, really difficult, and we're going to harass you continuously, and you'll just give up. And because you forgot to check this box or that box, or we unfunded the local Medicaid office, so they can't adjudicate your claim and process your claim. And then you just get frustrated and give up, and you miss appointments. Yeah. That's the attempt. So we need to reach out there and stop that, and help those people who need help. Because that's one of the, the tricks that they're using is those, elderly people that can't navigate the bureaucracy. People are on disability, physical disabilities, mental disabilities that can't navigate the bureaucracy. Those people get kicked off. They're still eligible if they really, really fight and know how to do everything perfectly at the right time, and the local office helps them out, then they're good. But unfortunately, yeah, and I'm coming up with my new website, so my new platform that's going to help with all that. So, yeah, I'm 24/7 on that one.
Hello. Thank you so much for all that you do. My question is kind of long. My husband is drawing his full Social Security, full retirement age, and we both have Medicare at this point. I will reach my full retirement age in March at 66 and 10 months. His PIA is more than double mine, and I'm deciding whether or not to pull the trigger now on spouse benefits with the reduction, of course, of a few months because of the political environment. The question is if I do that now, how, if at all, will it affect surviving spouse benefits later if he were to predecease me after I reach my full retirement age?
All right. Good question. Thank you. Appreciate it. It doesn't affect it at all. When you take your benefits on your own record, doesn't affect your survivor benefits. It's only when you start those survivor benefits. I was talking earlier, if you take your benefits are reduced and then something happens the day after, Social Security is supposed to contact you and say, hey, do you want to switch to survivor benefits, or you didn't want to wait till your full retirement age? And since you're going to be your full retirement age and your husband's going to live another 50 years, then yeah, it doesn't matter. So you're good. Let's see. Diane, I do not trust easily, so I fact check the best I can. Dr. Ed passed my fact check. Oh, thank you for fact checking me. Yes, yes. I appreciate it. Yeah, if I get something wrong, I'll come on there the next day and say, all right, wasn't perfectly on this, and I might have misspoke on this other thing, but yeah, it's going to be a nightmare with all the MCOs. What kind of perks do you get with SSDI? Perks with SSDI? Well, one of the big things is after being on Social Security disability insurance for 2 years, 24 months, you're eligible for Medicare. So if you're 40 years old at 42, you can start your Medicare. You can start your Part A, Part B, but a lot of people, they don't know that they can get Medicare after 24 months, and they make a lot of mistakes. So for instance, one of the mistakes I've seen is people get approved after going, fighting, and they get approved after fighting for 2 years, and they finally got approved, and they continue paying for their own health insurance. And they don't realize, I say, your Medicare started last month. Oh, no, I have to pay for my own. No, your Medicare, so I didn't get a card. Well, they just lost in the mail and didn't update your address or whatever. But yeah, call up Medicare and get your card because you have Medicare. So a lot of people miss that. Or if they have health insurance from work, which probably don't because they're on disability, but if they have it from their spouse's work and their spouse is currently working, it's a current work, and that employer has 20 or more employees, then you don't have to pay for the $185 Part B premium. You can just refuse that. And yeah, you have to get the Part A, which is zero, but in the future, then you just get Part B in the future, and there's no penalty whatsoever. So a lot of people miss that. Leonard, am I eligible for my ex-husband's Social Security even though he is still alive? I am a military widow and was previously married to my ex for 6 years. He is 78, I'm 72. I do get DIC and part of my husband's Social Security. Okay, Yeah, 6 years is kind of things that previously married to my ex for 60. So if that's the ex we're talking about, you had to be married to him for 10 years. Unless you were married to him when he passed, then it's only 9 months. But if this sounds like this is a divorce type situation. So number one, you had to be married to someone for 10 years. But if this is another ex, then if that person is still out there alive and kicking, then if their benefit amount is less than half of yours, then you could just very well receive benefits if you're no longer married right now. So that was a complicated one. I'm not sure exactly what kind of moving parts we're talking about, but I did my best. I'm 70 years old with Medicare and Medi-Cal. I have property and so will medical effects. Should I remove my name for the property? Can you please give me some advice? So for Medicare, it doesn't matter. You can own all of California and no issues whatsoever. I know you live in California because you have Medi-Cal. That's what they call Medicaid in California. And this is a thing. One of the reasons why I think the Big Beautiful Bill passed, and all of these, or where the Medicaid cuts of part of the Big Beautiful Bill was included in there, and people didn't, weren't outrageous as much as they should have been, is because a lot of people don't realize they have Medicaid. They say, I don't have Medicaid. I have Star Plus in Texas. I have CanCare in Kansas. I have TennCare in Tennessee. I have Medi-Cal in California. I have Access in Arizona. Those are all Medicaid. Yeah. So if those people are gonna be shocked when they said, but I don't have Medicaid. No, you have Medicaid. But in terms of property in Medicaid in California, in most places, you'll have to contact your Medi-Cal office. But in most places, those type of, needs-based, welfare-based benefits, they exempt one home and one car. So if your property, that's your house and that's your property, your house is on that property, then it's exempt, no issues whatsoever. So you can have a $15 million mansion and a Lamborghini, and you could still technically get Medicaid or SSI because those two are exempt. Don't ask me why, but anyway, rich one day, not so rich the next day. But if you have a Lamborghini and then a $200 wreck out on blocks in your front yard and it's registered your name, you don't get it because that's a second vehicle. Yeah, in most states. And I've had that happen, unfortunately, but it doesn't run. You got to get it out of your name. Peter, I'm on SSDI. The state pays my $185 per month Medicare Q1 individual. If the state stops paying, can I cancel my Medicare and rely on Indian Health Service? I am a member of the federal recognized tribe. Anybody can cancel Medicare Part B. You can't cancel Part A. Well, there's an exception. If you have to pay for Part A because you didn't pay into to Medicare long enough, some people do actually have to pay for Part A. Very, 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 very small percent. They just didn't pay into Medicare long enough, the 10 years, so they have to pay for Part A. But you have to keep Part A. But yeah, anybody can cancel Part B. However, the repercussions are, if you ever change your mind and want to sign up for it again a year, 2 years, 3 years, 4 years down the line, then the repercussions, that's when it's going to hit. So 5 years later, if something happens to the Indian Health Service there, or you move or something like that, and then you want to go ahead and sign up for Part B, then you can do it. But you can only do it January, February, March during the general enrollment period. And you're going to get a 10% penalty for every 12 months you did not have Part B. So if that's, 5 years, that's 50%. And you're like, 50% of what? 50% of the $185. So, all right, let's get another video question here.
Hi, my disability income hasn't been taxable, but all of a sudden I see on my checks that go through my bank that it's doesn't say disability income. It says like regular income. And the other question I have, if I draw like $34,000 a year, is any of that going to be taxable with the new Trump regime that he's put in style? I'd like to know.
Okay, so sounds like you reach your full retirement age. So yeah, so that happens to everybody. Once you hit your full retirement age, if you're on Social Security disability insurance, if you're on disability, then once you hit your full retirement age, you're no longer on disability. They switch you to regular old retirement benefits. So that's probably what happens. So that's why but it doesn't, obviously you got your check on the same day and you got your same amount. It just says something else. That's because they're no longer taking the money out of the Social Security Disability Trust Fund. They're taking out of the regular old Social Security Retirement Trust Fund. Most people don't even notice the difference because they get the same. So nobody in the country is on disability after their full retirement age. And I know people are yelling at the screen, I'm on disability. I've been disability. I'm 78 years old. I've been disability for 30 years. No, you're not. You might be disabled, but your check is considered retirement benefits. It's still the same check. Nobody cares. It's just a bureaucratic thing. But there's two things in there a lot of people mess up on there and make their lives hard for themselves is number one, because they think they're still on disability, at 67 or 77 or 87 or 97, they think, well, I'm on disability, so I guess I can't work that part-time job my friend offered me because I don't want to stop my disability. No, take the job. You're not on disability. You're on a regular retirement. And because you're past your full retirement age, you can make $1 billion a month and Social Security doesn't care. And number two, stop worrying about CDRs, continuing disability reviews. You will never, ever, ever get another disability review after your full retirement age because you're not on disability. So there's that. So, Rhonda, I'll be 62. And I can't find a job. Can I collect my Social Security when I turn 62 in February? Absolutely. But you have to be 62 the entire month. So unless you were born on the 1st of February, you have to start your benefits in March and your first check will come in April. The March check comes in April. So remember that for your timing, but absolutely. And Rhonda, the situation is you can't find a job right now. So you want to go ahead and turn on your Social Security. Perfect. You got to pay the bills and everything. But here's what happens sometimes. You go ahead and file, you get your first check, get your second check, and then all of a sudden you find a job. And it pays more than Social Security allows, $23,400. And you're like, I can't take it because I'm on Social Security. No, take it. You can, there's several options you have. Within 12 months of starting your money, you can withdraw your application. Like it never happened. You call Social Security and says, hey, I started my retirement benefits and, I found a job or I changed my mind. So I want to withdraw my application. Like it never happened. And because it never happened, you also have to pay back all that money that you got since. And another way you can do it is if you're going to make, $60,000, $70,000, $80,000, you just call Social Security and say, hey, I'm going to make $67,000, $80,000, and they will suspend your benefits. So, and then you won't get a check and you won't get overpaid and you won't go into all that nightmare. And what happens is if you suspend those benefits, you're not going to lose that money. They're not going to give you that money, those checks later. What they do is they recalculate your benefits. And here's how it works. If you start your benefits 30 months early, your benefits are reduced by 30 months. And let's say you go to back to work after 10 months. So you only got 10 months worth of checks. And then you hit your full retirement age and the Social Security system looks at your thing and says, hey, your benefit is reduced by 30 months, but you only actually got 10 months of benefits. So we're going to recalculate your benefits, annual reduction factor, adjusted reduction factor. It's called ARF. And from now on, your benefits are only going to be reduced by the 10 months that you actually took your benefits early. So, and that's 100% automatic. You don't have to do anything at all for that one. All right, let's see, we've got another question.
Hi, I'm Amanda, and I'm from Arizona, and I was wondering if you could help me with a question about using my ex-husband's Social Security record. We were married in 1987, and we were divorced in 2002. When we were married, I stayed home when we had a child. Then I stayed home with the children until we divorced. His work record is longer than mine. He also was married, but his second wife passed away. And I was wondering if I could use this for my disability Social Security, because it would be a greater amount to go towards it if I could use it. Or is that something you have to wait until I'm 62? Supposedly, and I learned this from from your channel, Dr. Ware, that at 62 you can claim it, but I didn't know if it changes if you're on disability and if you could claim it as your record then. So if you could let me know, that'd be great. Thank you.
All right. So, okay. So, yeah, for just regular retirement benefits, spouse benefits, 62. So you were married for the 10 years, so you're good there. For an X, the X has to be at least 62 years old or collecting benefits, disability or benefits, whatever the case may be. If they don't have to be collecting benefits at 62, after they're 62, as long as you were married 10 years and you've been divorced 2 years. It's called independently entitled divorced spouse. But anyway, I'm confusing people. Anyway, but in order to collect disability benefits on someone else's record, the only way you can do that is for a spouse is called disabled widow's benefits. So that person has to be deceased. There's like a 7-year period there. And then you have to be between the age of 50 and 59, and you can file for disabled widow's benefits from the record of a spouse. And the only other time you can receive benefits from, another spouse like that is obviously regular spouse benefits, but disability benefits, a child can receive disability benefits from a parent. So that's the only time you can receive disability benefits from another person's account. So you're going to have to, if you want to file for benefits on his record, you have to start just regular old spouse benefits at 62 years old, and you have to file for benefits on your own record. And it sounds like you're already receiving disability, which you're already receiving benefits on your own record. You just file for benefits on his record, and it won't affect your disability. You'll continue to get disability. You'll just get more money if there's more money on his record. One offsets the other. You don't get both. Well, you technically get both, but one offsets the other. So for instance, if you're entitled to $2,000 on your ex-spouse or ex-spouse's record, and you're getting $1,000 yourself, you don't get $2,000 plus $1,000. You get your own $1,000 minus the difference, $1,000 on that for a total of $2,000. So it's confusing, right? What are the disadvantages to Medicare Advantage plans be traditional versus traditional Medicare? Prior authorizations and networks. If you have original Medicare, just Part A and Part B, you can go to any doctor in the country. There's no prior authorizations for pretty much any medically necessary type thing. But if you just have original Medicare, then there's a lot of gaps there. There's a lot of gaps in original Medicare. So you just have to make sure, I think I have a little chart on that. Do I? Yeah, here we go. There's a lot of gaps in original Medicare. There's the deductible, Part A deductible, $1,676 out of pocket. That could be many, many times a year. You've got a skilled nursing facility, Part B deductible. The big one is this one, the co-insurance. So you pay 20% on anything Part B covers. And so that's a big one. So original Medicare is awesome. If you can afford, if you can get a Medicare supplement plan, those are always the ones I recommend, a Plan N or a Plan G. But if it's just not in your budget, then it's not in your budget, then get a Medicare Advantage. Just takes a little bit more work, and sometimes you might have to fight for prior authorizations and networks and all the rest of it, but fight, because Medicare Advantage plans, people always say, well, this company is so awesome. They gave me this, and this other thing, all for $0 per month. No, they can give you anything. They're returning money to you. All that money you paid into FICA. FICA includes Social Security, Medicare. All that money you paid into FICA, Medicare, all those decades, and the taxes you paid, all those decades, that's sitting in a pot. chock full of nuts can out in the backyard of the Department of Treasury or White House, wherever the case may be. And when you sign up for that Medicare Advantage plan, they say, it's zero premium. We'll give you gym membership and this and all these cool bells and whistles and free ice cream and unicorns. And you're like, oh, you guys are so awesome. And then you sign on the dotted line, and then the CEO of that company takes their begging bowl to Washington and says, hey, we just signed up Texas TOK. Give us that person's money. And then the government gives that company a certain percentage, a certain amount every single year. So you're paying for it. So your job in your retirement is to get back the money you already paid into it. So go get all your, preventive maintenance, all of your checkups and colonoscopies and all that kind of stuff. And if they offer you dental, use it. If they offer you vision, use it, because that's your money. Go get your money. It's like, paying for a car, not go and pick it up, Oh yeah, I paid $15,000 for that car, but I think I'll just leave it at the dealer. What? Go pick it up. So there's that. There's my spiel on that one.
Good morning, Dr. Ed. I have a question that I'm very, very confused about. This morning, I was going to go in and file. I actually went in and started the application to receive Social Security. I am 67 years old. I was laid off in November of 2024 from my company. I received vacation pay. I also received several weeks of severance pay, but it was lumped all together, and it was reported on my W-2, my 2024 W-2. So my vacation pay, as well as the severance payments, were reflected as earnings with taxes taken out for Medicare, Medicare and Social Security taxes, FICA taxes were taken out. I am not working now, but I'm trying to understand if those payments that I received between November of 2024 and through January of 2025 could be considered special payments, although my company reported me receiving all of that income in 2024, because I believe that's when they started the process of sending that money over to me. I am very, very confused. I really would like to submit my application for um, Social Security as I'm running out of money. So if you can please get back to me via this video, um, or just respond to me via email, I appreciate it. Thank you.
Okay, 67 years old, young, wrong, right? Okay, awesome. Okay, so, and you obviously done some research. So you use the correct word. These are special payments. So, if you're starting your benefits at your full retirement age, doesn't matter, no relevance whatsoever. But let's say your full retirement age is July, and you wanted to start your benefits in January. So they're going to say, oh, okay, are you going to be under the $23,400 for this year? And well, if you're full retirement age this year, then it's $62,160. So that special payments might not be an issue. But yeah, with the special payments, anytime a special payment comes in for a previous period, you sold back annual leave, or you got some bonus or commission or whatever the case may be, it's considered earned when it was earned, and it was just a delayed payment. So this happens to federal employees, OPM, that it takes months for them to, do your pay. And then 6 months later, you get all your annual and sick leave and everything that you sell back. And then people start freaking out. Oh my God, but I started my Social Security and now they're going to, it's no big deal. If it probably won't show up when you go down and actually file for them for your benefits, they're going to ask you when you stopped working, and you just tell them when you stopped working, and you just say, what they will do is they will, in the MCS, modernized claim system, they will check off the little boxes on non-service months. Make sure they do this and tell them, I will not make over X amount, the $23,400 or the $62,160. However, I did get some extra payments in January, so that's probably going to go on my tax return. And you're going to see that next year when the tax return is reported, the taxes are reported to you, and you're going to say, you told us this, but no, you just tell them that's for a previous period. That's it. So go ahead and start it and just, just tell them it's for a previous period. And if that person doesn't code it correctly, and then when you get your, taxes and everything and all your W-2s for next year, and then the computer system looks at it, the computer system will immediately kick it out, and they might send you an overpayment that says, you said you were going to do this, but you did that. What it is that person didn't code it correctly. So you just go back in there and you show them the documents and they say, oh, okay. And then you say, go educate that person. So there's that. All right, let's see what else we got here.
I'm going to be 78 on July 30th of this year. I am on disability. I get over $1,600 now, but I'm not sure if that's also my retirement Social Security. Could you help me out? And I also want to know if I'm eligible for dental and eye. Thank you.
All right, very soft-spoken gentleman. Okay, so not sure if you heard, but said he's 78 years old and didn't know whether his benefit check was for disability or retirement. If you're talking about disability, so you might have been on disability before, but yeah, once you hit your full retirement age, for you, it's probably 65, 66 or whatever, then yeah, it's retirement. So the benefits you're getting now are retirement benefits. And then the question about dental, original Medicare doesn't cover dental as we think of it. If you're in a car accident or something, you get your jaw, then, it covers dental, but regular dental stuff, no, it doesn't cover it, unfortunately. If you have a Medicare supplement plan with your Medicare, original Medicare, then it doesn't have dental. If you have a Medicare Advantage plan, those do have some level of dental. So you can reach out to Chapter and see if there's anything else out there. But if you have a Medicare supplement plan, you're going to need a separate dental plan. If you have a Medicare Advantage plan and it's terrible, then you might get another dental plan. However, I and Chapter both don't like dental plans. Sorry, those people out there selling dental plans. It might be good. Go to a dentist you like and say, hey, I don't have dental. Can we make some type of cash deal? Or if it's, a close dentist and, that you regularly go to, they probably have some company they work with that does dental insurance. And then you can just, usually on those is if you sign up for a dental plan, it covers pretty much nothing for the first 6 months or year or 2 years or something. So you're like, hey, I'll sign up for a dental plan, pay $40 a month. And then you can't do anything for 2 years except for cleanings and, small little things. So yeah, I'm not big on dental plans across the board. But if the dentist says, oh yeah, in your particular case, because, it's not an emergency and we can do this, we can do that, then then follow for whatever the dentist says. And if you trust that dentist, then go for it. If my Medicaid is canceled, who has to pay the $185? How do I find out what Medicare covers? Thanks, Ed, for all you do for us. You're welcome. If your Medicaid is canceled, then you will pay the $185. It'll come out of your Social Security check. And here's what's one of the problems is going to be is that even those people that are eligible for Medicaid, they think, oh, that's not going to touch me because I am eligible. I am an American citizen. I'm disabled. I'm elderly, yada, yada, yada. Doesn't matter. You could still be collateral damage. You'll get it back, but if something happens and your paperwork falls through the cracks, they might cancel your Medicaid, and then you just have to go down there and fight and get it back. So you might have to pay that $185 for a month or two, but they'll pay it back. But that's no consolation of, not having it for that month or two. So.
Hello, Dr. My name is Ali Mega. I live in Georgia. I received a letter from Social Security Bureau. They say the state of New York City will no longer pay my Medicare Part B and insurance after May 2025. So my premium starting June 2025. They say we pay Social Security benefits given for a given month in the next month. So they say I will receive 394 by July 2025 around August 1st.
Okay, so yeah, the reason New York is no longer going to pay for your Medicaid, your Medicare Part B, the $185 is because it sounds like you're no longer living in New York. So now you're in Georgia. So all you have to do is go to Georgia, the Medicaid office, and apply for Medicaid in Georgia. And it sounds like you're low income, so they should qualify you. Yeah, do that as soon as possible because yeah, you're going to have to start paying that $185. In Georgia, they're the one of the states that have already done the work requirements that you have to work a certain amount, 80 hours or something a month. Not sure about Georgia exactly how much they're making you work, but yeah, Georgia already has the work requirements for people on Medicaid. But there's exceptions, if you're elderly, disabled, all that kind of stuff. So, but a lot of research has been done on work requirements and receiving Medicaid and monitoring all that. And they said it costs about 3 times as more to monitor it than if you just gave people health insurance. So it's crazy. So, all right, let's see what else we got here.
Am I going to have to fill out all these forms every 6 months too?
Yeah, that's so that's the new requirements for Medicaid that are going to start happening nationally after the election. So it was about every year. Now they're going to do about every 6 months. States have some type of kind of wiggle room to change stuff around and ask for extensions and all the rest of it. But yeah, you definitely you just might have to, unfortunately. You just have to, and you have to make sure it's done correctly and make sure you follow up on it and stuff. And that's why I'm coming up with my my new part of my website that we as a community are going to come together and we're going to make sure that doesn't happen to you. So when you have all those documents that you need, there's going to be someone out there to help you out. So let's see, YouTube is already running the ads for call now for your stimulus check. Oh my gosh. And yeah, that's probably, if YouTube's doing it, that's probably 500 times worse on Facebook or something like that. That's just, yeah, stop it, people. I told my sister to file for Social Security, but she did not have to Part B. She is on her husband's insurance. Is there a way she can get her money back? Usually not. If you filed and started your Part B and then realized later that you shouldn't have, then yeah, usually, you're kind of stuck. Yeah, unfortunately. But if it was one of those things where they started her automatically and maybe she can go down there and fight and says, hey, I just realized, a month or 2 months later, when I got my check, I saw it was short, and they might be able to make an exception. So, hey, it doesn't hurt. All they can say is no and get out of the office or something. No, they won't say that unless you really cause an issue. Okay, let's get another question here.
Yes. Hi, Dr. Ed. My name is Gypsy, and I am 68, soon to be 69. And I'm on SSI. And because I'm on SSI, I automatically am eligible for Medicaid. If they take my Medicaid away from me, will I lose my SSI? I'm having a really hard time understanding this, these with this big bill that was signed, but if they take away my SSI, if they take away my Medicaid, could I lose my SSI? I'm just trying to understand. And also the premium for B, that.
Okay. So Gypsy, there you go. There's Gypsy. Hey, Gypsy. Okay. So you got it kind of reversed. If you lose your Medicaid, you won't lose your SSI. If you lose your SSI, you'll just might lose your Medicaid. So, but not the reverse. If you lose your Medicaid, it doesn't affect your SSI at all. Your SSI, that's the supplemental security income. That's the needs-based program that Social Security administers. And as long as you're low income, low resources, and if you're eligible for SSI, your SSI will continue. No issues whatsoever. Your Medicaid, that's a whole different thing. If you lose Medicaid, then yeah, or you're downgraded. People don't realize, they think Medicaid is Medicaid, and it's not. There's different names of Medicaid throughout the country, and there's different levels of Medicaid in states, QMB and SlimB and QI and all this kind of stuff, right? So people think, well, yeah, but you still got Medicaid. Yeah, but I was downgraded from QMB to regular Medicaid, and then I lost $185. I have to pay more for my doctors and hospitals and visits. I have to pay co-pays. I lost my Medicare Advantage dual eligible plan, so therefore I lost my $200 a month grocery card. I lost my transportation. I lost my home help. It's a trickle down effect that, yeah, see, there's trickle down economics. We have finally found trickle down economics, but yeah, guess what? Yeah. Anyway, it's not the one they were promising us for the last 30 years. So the only thing you can do is, make sure all of the offices, always SSI, Social Security Administration, your Medicaid office, make sure they have your correct address. If you get documentations for the recertification for any of those, you make sure you fill those things out completely. And I'm coming up with a website to kind of help guide you through all that, be some extra help. So hopefully when that nightmare process starts, then we will be prepared for it. All right, let's see. I think we've got, I'm way over time, but I've got some videos that I missed. So let's get into the ones I missed the last few days.
Hello, I'm about to retire in like 6 months. I'll be my full retirement age. My benefit is like $3,200. Would it be better to wait till I'm 70 and collect the other 24% to make up for the whatever percentage we're going to have our Social Security, Medicare and stuff cut? What, 30 or 2032? I can still work, no problem. I've got a son that is paralyzed. That, right now, he collects Social Security on his stepdad, and when I retire, he'll actually be making more money. Or should I wait and get more myself?
Okay, good question. And for the first part, can't really answer it. Really, your personal decision. Yeah, but if Congress doesn't do anything, government doesn't do anything, and they don't solve the problem of the future cuts, which they've had 30 years to do it, but obviously, anyway, then yeah, if you wait till 70, you'll get an extra 24%, but possibly by then the trust fund's going to be diminished, and there's, so it might even out to, zero, but at least you won't get a 24% cut. You've already figured in the 24% cut. So yeah, on that, you just have to figure out, what's best for you in terms of your whether you need money now, longevity in your family, your health, and all that other kind of stuff. But you have another variable in there. that you could wait another 3 years to collect benefits on your own record, but that also means your son has to wait 3 more years to collect benefits on your record. So your son will be able to receive 50% if that's the only child that you have. He'll receive 50%. So if you said what, 32, let's say $3,000. If your full benefit amount is $3,000, he will receive $5,000 or $1,500 a month. So half, 50% of your full benefit amount. And if something happens to you, he'll receive 75% of your full benefit amount. So that is another variable that if you're just thinking about you, then if just taking that variable into account, then, you know, your longevity in your family and how healthy you are, do you need the money and all that kind of stuff? What do you really think about the political situation? But then you've got that on a variable. So if you start your benefits now, then your son can also start those benefits now as well. So I think I have one last video and then we'll call it a
I
night.
listen to your videos on YouTube often. I am blind, and I want to ask 2 really quick questions. First of all, thank you for making your website screen reader accessible to those of us who are blind or low vision. And the 2 questions I have for you really quickly are, for any of us who get CDRs, is that law still in place where if we need assistance in physically filling them out, that we can still go to the office because of our visual impairment, or in my case, total blindness? I don't have any kind of support. And I know there's been a whole bunch of fluctuations going on, but it's been a huge concern of mine. So I wanted to ask about that, especially because I'm not physically able to write in my answers, and I would need them to do that for me. So I want to ask you a bit more about that, and if I need to contact Congress, how that would work. Um, Second question, really quickly, and more of a comment, is I think it's absolutely ridiculous that this big, ugly bill passed, and myself, including a lot of others who are dual enrolled, are very concerned about the MSP program. I am on a PPO plan. It's dual special needs, and I'm very concerned that my state will drop me down to HMO once they lose funding. So what do I do if I want to keep my current doctors? They only take PPO or original Medicare, but they do not take HMO. Thank you so much for everything. Have a great day.
Thank you very much for that message. All right. So the first part, getting help with the documentation, getting help filling stuff out. I don't know if it's a law or not, but it doesn't matter. Civil servants, that's the name, to serve this, to serve society. So if you go into a Social Security office and you need help filling out a form for whatever reason, then you demand. And the person behind that counter, you know, obviously, you know, you have to understand they've got another 400 people probably in the lobby, and they're overwhelmed and they're super short staffed. You know, Doge and Elon Musk kick so many people out. So, you know, they're in a tough situation too. But that doesn't excuse anybody. If you go in there and you need help like that, you demand help, and you just tell them, hey, I understand you got 400 people in there, but I really need to do this. And this is a deadline. I had to get transportation down here. I can't come down here again. So whatever you have to do, talk to your supervisor and, you know, do whatever, say, hey, this interview is going to take about an hour because we need to help this person fill out this paperwork. And then the supervisor won't harass the people for taking too long and stuff like that, because the supervisor monitors all this kind of stuff. And the supervisor's boss, you know, which was me at the time, had to monitor, make sure everything was going along. But if you just say, hey, this one's going to take a lot longer than normal, no problem whatsoever. That's their job. And if they refuse that for whatever reason, if this is a nasty person, we have them, every place does. Then you just say, hey, can I speak to a supervisor, an OS, an operations supervisor, or the district manager, the assistant district manager, and get another person that's going to help me out, a little bit more patient. And then call your congressman if, you know, none of that happens. And then tell them, say, okay, you know, you're not helping me. I'm going to go outside and I'm going to call my congressperson right now. And public relations and the local news media, and just, yeah. So hopefully he won't have to go to that, but yeah, they better help you out and come back here and tell us how it went. And in terms of the PPO and the HMO, yeah, that's The Medicare Advantage companies are reading through the big, beautiful bill, the big, ugly bill, whatever you want to call it, and they are seeing that Medicare is going to be cut because of the pay-go system. And it's we won't know 100% for sure until October 1st when the new Medicare Advantage plans come out for 2026. So you can reach out to Chapter there and tell them, hey, put me on the list. And when the new plans come out, you have between October 15th and December 7th to reevaluate and check your plan to make sure it's still the best plan for 2026. But I think those extra benefits and the networks and all of that stuff and charges, and it's not going to get better next year. So as usual, reach out to your politicians and see if we can do anything. But all we can do is try, right? So, all right, I'm way over this time, but we had a lot of great questions, and you guys are awesome as always, looking out for each other, answering each other's questions. Y'all have an awesome night, and we will talk to y'all again tomorrow. Please take care of each other.